A local surgeon is helping patients with throat cancer avoid chemotherapy and radiation treatments with robotic surgery. Here with more on this minimally invasive approach is Dr. Kunal Jain, assistant professor at UTHealth's McGovern Medical School and head and neck surgeon at Memorial Hermann, along with his patient, John Bush, who I understand is doing well now, doctor, after meeting with you. John, we're going to get to your story in just a moment. But Dr. Jain, first of all, just describe to us, what is transoral robotic surgery and how can it be used?
Hi, thanks for having us. Transoral robotic surgery is, we used to have to do surgery where we kind of split your jaw to take cancers out in the back of your throat. You'd need a tracheostomy, which is like a breathing tube in your neck, and a feeding tube. But now with the robot, you're actually able to place the arms of the robot in the patient's mouth, as in Mr. Bush's case, while you work on a console kind of far away from the robot, and your assistant is by the bedside. You avoid all those things, and that way patients are able to get out of the hospital in 2 to 3 days rather than a few weeks. They're able to potentially avoid chemotherapy and radiation therapy. The robotic surgery probably started about 10 years ago in our field, and we're really kind of using that more so for throat cancer patients.
And it seems like when you, even just hearing you say breathing tube, feeding tube, chemotherapy, radiation, I mean, typically this is a type of cancer that would have come with a lot of problems after any sort of treatment. That's not the case when we're talking about this robotic surgery.
Yeah, that's correct. And, we weren't even offering those surgeries for a while because of just the side effects. The patients would usually just get radiation therapy and chemotherapy. But now with this new technology, we're able to offer a surgery and avoid the side effects of radiation and chemo as well. So it's a big change, and there aren't that many people in Houston that do this. Probably just 2 or 3 surgeons, and luckily I was trained to do this, and Mr. Bush was able to come and see me, and we were able to take good care of him.
And John Bush, your patient there. John, as we mentioned, you were doing a lot better today. Back up, though. What kind of symptoms were you experiencing, and what was your experience like going through this surgery?
I woke up one morning. Thanks for having me, for one. I woke up one morning, and I had a cyst on my neck, and saw my family physician, and she prescribed me a Z-Pak, thought maybe it was just a swollen lymph node or something, and said if it doesn't go away within like 10 days, call me. And it didn't, got bigger. So she referred me to Dr. Jain, and went from there.
And today, I mean, tell us just about your quality of life. How are you feeling? And I understand you're going in for frequent check-ins now?
Correct. I'm cancer-free at the moment. Hopefully we'll stay that way. So I go and see Dr. Jain about every 6 weeks, and he'll do a physical checkup on me. And then I also go for a scan, a body scan, about once every 3 months.
Well, that is fantastic news, John Bush. I'm glad you're doing well. Dr. Jain, we're super tight on time, but for anyone watching at home, how can people out there prevent this type of cancer?
Yeah, I mean, I think the biggest thing we're doing nowadays is we're vaccinating all our kids with the HPV vaccine, because this is cancer that is caused in a lot of patients by the HPV virus. But it's just like Mr. Bush, if you have a lump or you're worried at all, come see your doctor, come see us, and the earlier we catch it, and the more likely we can treat it.
Well, it is incredible that people can move on with their lives. John Bush, thank you so much for sharing your story. Dr. Kunal Jain, we appreciate both of your time.
Thanks for having us.
And if you all would like to learn more about this procedure, you can call 713-486-5000. Now I'm going to send it on over to Courtney in the kitchen.
All right, Derek, thanks.